Okay, so today we're talking primarily with Dr. Darren Aboyoun. Going to ask him a lot of emotional packed type of questions and just therapy and some general knowledge about that side of what we do here at NextPhase. So, Dr. Aboyoun, thanks for joining us. Listen, I want to ask you first off, how does therapy work? What is therapy? How does it work?
Hi, Joe. It's a good question. It can seem mysterious to some. Process of therapy has to do with finding someone who's a good fit for you. So processing painful, difficult feelings in the context of a relationship that's trusting. I think you can relate to this in your own work, that you have to engender trust with the clients you work with. So from a plaintiff's point of view, feeling that this person has the ability to understand their difficulties is one of the most important things to kind of set the stage of therapy. And then talking through what happened and how that's affected you is a way of emotionally processing it. So it has what I say, it kind of depowers it for some. So your the emotional response you have to the thoughts of what had happened, the traumatic experience, starts to weaken and decrease. And it doesn't take up as much bandwidth or emotional real estate as you kind of are thinking about things over and over again. Or you might be just minding your own business and then a thought comes in and now you're feeling badly about it as a result, or having some kind of feeling about it. So therapy helps to reduce that.
Well, how do
And
I
it,
know that how do I know that I might need therapy? What are the signals that might, trigger, say, hey, seeking out some therapy here?
it's interesting. Sometimes people get that input from their family members, like something like you don't seem like yourself, or they might be signaling that in some way or another by that kind of comment. You don't seem like yourself, or you seem down, or I notice you're not as cheerful as you usually are. So a couple of criteria. One is if you're having some kinds of symptoms of anxiety, depression that are interfering with your capacity to do your activities of daily living, or if it's affecting your relationships, like I just want to stay in bed. I don't want to go out and meet up with my friends, or I'm feeling so anxious that the idea of going to the grocery store just makes me feel very uncomfortable. My hands start to sweat. That's a good sign that it would be helpful to consult with a mental health professional.
Okay. Um, what are some of the ways you start to begin to cope with your emotional distress?
I had a colleague who used to say, you have to name it to tame it.
Okay.
And the first thing is starting to put language on what your thoughts and feelings are. Now, for some people have trouble with that, or they never had to do that, or they never had to think about how they felt or what's happening to them internally. If you're a plaintiff, this might be the first time you're having such strong, painful feelings. It's like, or certainly the most painful feelings you've ever had in your life are up there. So, um,
How do you start dealing with it though? Like, how do you start to cope with this? Is
so
it right to therapy, or is it something you're doing at home? Just kind of give me a feel for what the might be a good approach for folks.
first part, I think, is gathering some information to start to make sense of what it is you're experiencing. And that way we can start to refer to this. So if it's starting to deal with this is, this is what anxiety looks like. My heart's racing, my hands are sweating. I don't want to leave my house. That's that's the beginning of starting to understand it. And then to get to your question of how do you start to deal with this, if we know that that's what it is, it's very treatable. It's very workable. One of the first things is trying to identify what it is that is provoking this reaction in me. Is it just the thought of going out? Is it, oh, wait a second, I have to actually get in a car. I had a terrible accident. I don't want to be driving right now. This is very uncomfortable, or I'm just afraid, or I could walk out my house, or I could walk somewhere, which by the way is an also thing that can happen for some of our plaintiffs is they might have an accident in a car and they might avoid driving or being a passenger, And then what can happen when it's left untreated is you could start to be afraid of just leaving your home, even if just walking to the store.
That
Um,
escalates,
so
yeah.
to answer your question, first is we try to understand what it is that's happening, and then learning how to have some distress tolerance skills. Sometimes it involves exposure. You have to confront the things you're afraid of. That's some of the best ways of starting to work through it. I hope that answers some of the questions.
Yeah, if we get to that point, kind of taking this progressive as far as like, okay, what is therapy? What signs should I be looking for? What are some of the things I can start to do here at home on my own and start recognizing it? Okay, I'm thinking I need a therapist. I'm speaking as the injured plaintiff here, obviously. I'm thinking I need a therapist. How do I go about finding one? And you can talk specifically, inside of NextPhase and without NextPhase. Just
Yeah,
how do we find a
yeah.
therapist?
No, that's a critically important question. Sometimes people feel like I don't know even know where to start.
Right.
So, by the way, I had a colleague who would talk about well visits, and there was a campaign at one point that I think it's still a public health campaign of you should talk to a psychologist, like having one meeting with a psychologist to find out, is there something that I could benefit from some kind of mental health treatment? And that's not a bad idea. And if you've been involved in some serious accident, I would say absolutely have a consultation. One consultation could be very helpful, even if you never need it. At least you started something, you can gain some insight in that. So how would you go about finding someone? One way is to look at your insurance provider list to find some referrals from there. Almost every insurance company has paneled mental health professionals. And that could be a master's level therapist from a social worker or a licensed professional counselor to a PhD psychologist. Psychiatrists tend not to do therapy. They tend to prescribe medicine. So you could start with your insurance company first. Then you could also go, like so many other things, online, look for a therapist directory, like the Psychology Today therapist directory. Chances are you can do your own research to see what profiles people have, see if somebody would be a good fit for you, if what they say in their profile, and if their comments speak to you. That's a good start to try to find someone. I often tell people you want to cross-reference from maybe some directory to with some of your insurance panel.
And inside of NextPhase, we're going to be able to do some of that, helping that process along. We're going to have the group meetings. We're going to have the one-on-ones, things of that nature. I'm sure in those meetings, you'll be able to say, maybe you want to go a little bit deeper with the therapist, or, maybe some of that group is just enough to help people get through. Is that correct?
I'm really hoping that having more individualized contact with people will allow me to make some more specific suggestions about here's something that therapy would specifically work on, like this particular part. And here's how you can get support from the people in next phase. This is so important. One of the things that why therapy works is feeling that you are in a supportive relationship. And with next phase, if you are getting support from others that have gone through it, that's even more helpful because you don't have to explain yourself.
Yeah. Yeah. People have walked in your shoes.
Yeah.
Now, you brought up something that I've always had the question about in the specifics. You said, well, psychiatrists don't do therapy, they prescribe medicine. Can you just dive into the difference between a psychologist and a psychiatrist, and what the best use of both professions would be in a person's
Sure.
emotional?
I'm sure as I say this, I'm going to get some emails, some feedback that this isn't true. Generally speaking, generally speaking, psychiatrists are medical doctors. They've gone through medical school and psychiatric residency. They're trained in psychopharmacology. They're trained to prescribe medication for the symptoms somebody's having, either anxiety symptoms, depressive symptoms, or in some cases, psychotic symptoms. Many primary care physicians prescribe psychotropic medication or medications that alter our moods because there's not enough psychiatrists. There's a shortage of psychiatrists. Psychologists are doctoral level professionals. They're trained in the delivery of therapy. They have a better understanding of the relationship and of the mechanisms of change and how therapy works. and how to understand people's struggles and how that interacts with their personality. They just have more training in that area in particular, less training in pharmacology. And then there's master's level therapists, licensed professional counselors, or there's or licensed clinical social workers, or some who have a master's in family therapy. And those therapists are often licensed and provide therapy for people as well, just from a master's level point of view. Their training is not as extensive as psychologists.
So it sounds to me like psychology is more suited for what we're doing inside of NextPhase. It's that therapy, that really going in and developing that care, that emotional care, and that type of care that goes with this situation. If it gets to that point where it's medication is really needed, then that's kind of that's own next phase. Is that correct?
Yeah, if so a couple things I'll say about that. A good therapist that you connect with, whether they are master's level or doctoral level, is really important. That it's less critical some of the degrees, credentials they have. I mean, you want someone who's competent and has some experience with dealing with catastrophic changes. And inside that therapy, many therapists work in tandem with psychiatrists or primary care physicians with the medications you're taking. So a plaintiff having a host of medical problems would do well to be consulted, and that's in therapy. That therapist would likely be consulting with the primary care physician and talking about, think that this person may benefit from an antidepressant, or I think that this person's having sleep disturbance. Is there some way of medicating some of their sleep disturbance? Because that's going to have an effect on somebody's mood. That's actually really, really important, that many times there's a mood disturbance that's really more of a sleep disturbance, and knowing the difference and how to go about that is important for a therapist to be working with your primary care physician. So that's another benefit from working with a therapist, that they can help you coordinate with the medication you need.
Awesome. Okay, that's good clarification. A lot of people in NextPhase are family members of those that were hurt in an accident. Any special advice that you would have for a family member helping somebody who's been badly injured?
It's a great question and a bit of a complicated one. Learning, how do I say this in a kind of succinct way? Each person in the family is responsible for their own taking care of themselves. In taking care of yourself, you're going to have a better ability to be with your family and take care of your family. There are some who think, let me just take care of my family. Let me just, whatever they need. But what can happen in certain instances is, by not taking care of yourself, you're paying for your care for other people, and because you can sacrifice some of your own emotional health, and as a result, negatively affect the people you're trying to take care of, because now they're worried about you.
Yeah.
Like an example, I worked with somebody who was so concerned about their family, they never went to the doctor. They didn't take care of themselves. That it wasn't until they had a serious illness that they thought, oh my God, I got to take care of myself. So I'm sure you've seen this with some things you worked at.
I've absolutely seen this happen, where the caretakers kind of lose themselves in the whole process, and their own ability to cope and deal is you can see it being strained as the case wears on and the injuries linger and things like that. I always worry about the caretakers as much as the injured people.
Definitely.
Yeah.
And I would think this is like a beautiful example for NextPhase of where financial planning, I think it's wise to take into consideration, I have to be able to take a break if I'm the primary caregiver of this plaintiff and I'm involved. There has to be some money set aside for someone else to come in from time to time.
Respite, right?
That someone who says, oh yeah, okay, a spouse, I'm just the sole person, that's not a wise idea. I mean, or you know what we're going to do, Joe? my son, he's 18, he lives with us. When I go out, he can take care of dad who's been injured. I don't think that's a wise idea when there's a lot of complications related to that. Your son may have some feelings about doing that. And on top of that, there may be some times where he can't. And having a contingency plan for someone to take care of dad, for example, it's just wise to do that.
Yeah, and there's ways that are we can talk about in groups and things like that to do that. I think that's going to be, very important as far as the group discussions, how to take care of yourself if you're a family member of somebody who's been badly
And
injured.
well, I'm curious to ask you this. Does anybody ever talk, in your experience, have people talked about the money that's involved to take care, to ask someone to come in, to hire somebody to come in to take care, even if the spouse or some family member is the primary caregiver?
Yeah, that's always a question. How do you get through? How do you get some pay? And it's always more difficult before the settlement, certainly because nothing's happening yet. A lot of times the income flow has been cut, the expenses have gone up, and that becomes a problem. And then that's where you see the struggles. When we're doing a settlement plan, having a plan for respite care, to be able to go to the movies, if it's a son, child that's injured, for mom and dad to be able to just go out on a date night,
Yeah.
just to get away for a couple of days, flying grandma to spend some time, all that type of stuff we try to factor in because we know how important that is.
Mm.
The long-term success of a plan is you got to keep the surrounding and the network and the support system around that injured person up and running at the highest levels. And the way to do that sometimes is to have them get away and just recharge the batteries. And but like I said, that's a little easier once we know that there's a settlement coming in and we can kind of factor that into what's needed. It's the beforehand that we have to be really more diligent and do a better job of budgeting and scheduling and doing a financial breakdown to make sure that they're going to be able to get through those couple of years that they have to maybe before a settlement comes in. Maybe it's a couple of months, maybe it's a couple of years, but let's plan for the worst, and it's going to be a little bit longer and make sure they do it because yes, we do see family members struggling quite a bit, especially before the settlement happens because you just don't know where it's going, how I'm going to deal with this. The whole future is so, when you get to settlement, okay, you know what the future is. Let's go from here.
Yeah. This is one of those examples where I think next phase is so critical because one, you can get support from other people. So even if you can't break away, the very least is you need support and understanding, and that matters. And having a community of people that are going through this,
Knowing
will
you're not
help.
on an island by yourself is very helpful.
Oh, and someone saying, "Oh my God, I was there. If you hang on, this is really likely to get better with this." The other thing too is you just learn from other people. Or you can feel empowered by other people. Like, let me give you an example. Someone saying, I always thought I couldn't get away. And then finally, something happened where I was forced to, and it was so helpful. And that can be enough for someone to hear and think, I could do this, even though I'm going to feel terribly guilty, imagining I'm going to feel very guilty by going out for a
Right.
night or a weekend. That could help tip the scales for somebody to take that action and feel much better.
Then one of the things we can do next day is to help them enjoy that time away. You don't want to be away and just say, you know what, it was no good because all I did was I kept thinking about what's going on and what I should be doing and where I should be. And it just, I couldn't enjoy the moment where I was away from that because my mind is always, I think you almost have to do some preparation to get that respite program going. You have to start talking about what you want to do when you're away and making sure that you're okay and just being able to compartmentalize that off to the side so you can enjoy the moment where you're. It's easier said than done. I know that. I've been through that with my dad. Absolutely
Yeah.
easier said than done. But I see the importance of being able to try.
Well, some of that is kind of what we're talking about is adjusting your attitude and shifting and having the belief like it is okay for me. It's not only okay, it's necessary for me to take care of myself. This isn't depriving
Right.
someone of care as much as it's good for the two of us. Like I'm a better person. And one of the signs, Joe, I can tell you this, if you're short tempered and you're agitated every day, this is one of the signs that you need a break.
Yeah. Yeah.
That's your
I'll
first
see
tip
you.
off.
See you. Gotta go. I need a break. No.
Yeah.
We're tempered and
Our
agitated.
bodies tell us these things if we're willing to listen.
Yeah. Any other questions that I should be asking you, Dr. Boyne, about therapy and how it relates to what people are going through specifically in this personal injury world that we're all living in? Something I didn't ask that you feel is important for our listeners to hear.
Um, Another question, maybe I'll make some comments about this. And we were talking quite a bit about problems people have and difficulties. A counter to that, or I should say, in addition to that, is thinking about resilience. What are the things that help people get through difficult times? What are and that is a different set of attitudes about one's adversity. Um, Knowing that having some hope that things can be better. Also knowing that difficulties can help us to grow. And that may sound a little cliched, but when you live that or you have a glimpse of this, let me practice looking at this from a better point of view. Let me see some of the good things that have come from this. That may be a tall order and a stretch at some part in your settlement and in your recovery. But at some point, settling into, I'm able to find some peace in my life again. I'm able to make use of some of the good things that are happening to me. I'm able to find joy again,
Yes.
smile again. That know that that is possible and that there are ways to get there. There are easier ways to get there. And the whole point, a whole huge part of Next Phase is to help you get there more efficiently, quickly, with the help of other people rather than suffering or struggling alone. So we'll talk more about resilience and what are those ingredients as they come up.
Okay. Well said. That's a perfect wrap up for our discussion. I do see folks that are resilient that can get through it once they get to that point of settlement and knowing what the future does hold. There's a certain amount of acceptance and ability to move on. I always say that these folks that I work with are the most resilient I've ever met because
Mm.
somehow, we try to find that way to do it. This is a more formal process, certainly with Next Phase, and I think it's going to be a lot easier to help people this way than just being brought in for one aspect of settlement. And I think what you talked about here today is really going to be helpful. We're going to expand on all of this. This is just kind of a precursor. So we're going to be expanding on all these.
It's something to say about that. And you've had the good fortune of seeing this when people are pre-settlement and there's so much uncertainty. And now things are starting to move towards settlement and it's beginning to take shape. Like finally, there's just a sense of more certainty. And then you get to work with people at settlement, post settlement. I mean, both pre, at, and post, where there is much more certainty. And you help to bring in more certainty. Like there's a lot of uncertainty financially. Here's how we're going to reduce that for you. So there's even more of a payoff with this.
It's that final step before settlement of saying, turning those unknowns into knowns. And here's the thing, not all those unknowns that turn into knowns turn out the way you necessarily want them to or hope they would be.
Yeah.
But they are known. You at least say, okay,
Yes.
this is going to be my physical limitation going forward. At least you know that. This is going to be my financial situation going forward. At least you know that. And we make the best plan possible going forward. Hopefully a great one, depending on how everything comes together. But at least folks know that. And that alone is a little bit of relief. Getting done with the settlement process is closure. Moving on in their life is good. We're trying to get them to that point sooner and more or less stressful process. And then once that settlement happens, to keep that emotion. You don't just stop right there. It doesn't just get to a wall and stop. This process continues. There's always a next phase. There's always, even after settlement, even after life goes on, there's always a next phase.
Well, I would say to you, the amount of uncertainty needs to be proportionate to the amount of support you get. There's a high level of uncertainty, you need a lot of support. And as that changes, you need less support with more certainty in your life. And that's a big piece of what we're trying to do. Definitely after settlement too. You can rely on this income. This is how you're going to rely on it. You don't have to worry about the market fluctuating if you have a plan. So, I mean, I think these are things that people are not necessarily thinking of. Some of these uncertainties, it's usually, I think once I gotten this money now, it's kind of, I'm done with this, but there's other ways to make this even better for them, which is, I know you know this, but.
Absolutely. Awesome. Okay, well, that will conclude our discussion for today. Hope everybody enjoyed it, got some valuable information. Dr. Aboyoun, I thank you for lending your time and your expertise, as always, and we'll continue the process and working inside of NextPhase. So thanks, everybody, and we'll see you soon.